I'm going to hand over now to Casey Regan, who is going to talk about co-developing an intervention to support a community-managed organisation to provide preventive care. And Casey's a PhD candidate in the School of Psychology at the University of Newcastle, and her research aims to reduce chronic disease risk amongst people with mental health conditions through preventive health care. Casey.
Thank you. I'll just get my slides up. Otherwise I'll probably stop talking. Good morning, and thanks everyone for coming along this morning. So I'm Casey, I'm a PhD student at the University of Newcastle, and I'm in my third year now. And before PhD, I did a bachelor's degree in psychology, and before that, I was in high school. So my background is research, and not a lot of it, but I really love it, and I think this area is so important. Thank you to all the people with lived experiences, consumer representatives, service providers, and other researchers attending. It's been really valuable hearing a diverse range of experiences and perspectives. And thank you to the Equally Well Symposium sponsors you can see on the screen. Before I start, I would like to acknowledge the traditional custodians of the land on which we are meeting today and pay my respect to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. The focus of my presentation today is a co-development workshop with a community-managed organisation. That was part of a larger project, and the aim of that workshop was to co-develop some strategies with and for CMO staff to help them deliver support for lifestyle factors. I'd like to thank the partners involved in this project, so the University of Newcastle, Flourish Australia and the Australian Prevention Partnership, as well as Equally Well and Griffith Uni for hosting this presentation. Also to my supervisors, Kate Bartlam, Jenny Bowman, Libby Campbell, Caitlin Feely, and to Julia Dre, who managed the project. So today I'll briefly go through some background on why we're doing this research and provide some context as to how the co-development workshop fits within a larger project. Then I'll talk through what we did in the workshops, its outcomes, and what we've learnt. So firstly, the background. So I think the reason why many, if not all of us, are here is because we recognise and understand that people living with mental health conditions do experience poor physical health and are at risk of a reduced life expectancy. And a key contributor to that is the presence of lifestyle factors. So what can be done to address this? A preventive approach can be taken to address chronic disease by supporting people to achieve lifestyle behaviour change goals. So helping people to quit or cut down smoking, reduce alcohol intake, participate in physical activity, and eat nutritious foods. But what are some ways in which people can be supported? So by having conversations about behaviour change and being offered encouragement, being provided with education and advice, such as on the benefits of a healthy lifestyle and how this can impact mental health. And be connected to further support and behaviour change services. For example, the Quit Line, drug and alcohol services, exercise groups, and the Get Healthy telephone coaching service. But where could be delivering this support? So you may recognise some of the logos on screen. These are some Australian community managed organisations, which I'll refer to as CMOs. So CMOs are one setting in which to deliver this type of support, as these organisations are uniquely placed to address physical health. But why? Why are CMOs a good setting to deliver this type of support? Well, many people living with mental health conditions in the community are accessing these services, and we know that this group of people do want to make healthy changes and are receptive of care and support to do so. The nature of care is generally routine and frequent, so people might be accessing these services once a week, sometimes multiple times a week, depending on the severity of the condition. And because of that, there's generally an established rapport or relationship between the support worker and the person receiving support. And also because CMOs deliver person-centred and recovery-oriented services that aim to address holistic needs to improve overall well-being. So if the goal is to support people accessing CMOs to make healthy lifestyle changes, in our research team we ask ourselves, how can we help organisations to do this? We can take a co-development approach and collaborate with CMOs to develop some resources and strategies that they can use to assist them to deliver support. So by engaging in co-development with staff, we're more likely to develop something that is fit to practice and acceptable. So there are a few different terms to describe co-development, and sometimes this word can take on multiple meanings. But essentially, for the scope and purpose of this project, co-development occurred with and for staff. So the co-development workshop that I'll soon describe fits within a much larger project called CMO Connect. And this consisted of various data collection activities over the last couple of years with consumers, staff and leaders of CMOs throughout New South Wales. And the overall aim of the CMO Connect project was to explore the potential role that CMOs might play in delivering support to people with a mental health condition. So the last stage of the project was a small-scale pilot intervention. And the aim of that pilot was to co-develop, implement and test some strategies to assist staff in supporting people to improve lifestyle behaviours. And it's these strategies that we wanted to co-develop with staff, and the way in which we did so was via a workshop. So in terms of our aim, the aim of the workshop was to co-develop those strategies to be implemented and tested as part of the pilot intervention, with the goal of assisting staff to deliver support for lifestyle behaviours. So now I'll step through the workshop by describing the process and its outcomes. So, a 3-hour workshop was conducted with staff of a local CMO, and it was facilitated by 2 researchers. So the workshop was run on 2 occasions to maximise the number of staff available to participate, of whom were either face-to-face or zoomed in via, or video called in via Zoom. And the reason we opted for a workshop format was because was to enable staff to generate ideas collectively as a group. And the workshop was the most feasible way to do this, as the CMO was able to accommodate about 20 of their staff for 3 hours during work time. This CMO delivers programs and services such as daily living skills like cooking and shopping, transport and healthcare appointments, employment, education and housing and accommodation. So as I mentioned, the workshop participants were staff of this CMO across a few different roles such as peer and mental health workers, support workers, team coordinators and managers. So what actually happened during the workshops? Well, they were broken down into 7 parts, which range from about 15 to 30 minutes each. And each activity or discussion built on what had happened in the previous part. So in the first part, facilitators conveyed the need to address lifestyle factors, as well as findings from previous aspects of the wider project, which indicated that people they're supporting with a mental health condition do want to make healthy changes and are willing and wanting to receive support to do so. Then the facilitators proposed that some effective ways to deliver support involves having conversations, providing education and advice, and connecting people to behaviour change services. So after that, there was a group discussion about these ways to deliver support. So the facilitators prompted group discussion with questions like, what do you think about describing support in these ways? What are you currently doing in this space, or what aren't you currently doing? And that generated some discussion around the barriers and challenges of delivering support. So for example, in regards to having conversations, staff conveyed that conversations about lifestyle factors could be happening on a daily basis. However, they face challenges when someone becomes or feels resistant, as they wouldn't want to cross any boundaries. So how to overcome those barriers to have the conversations. Yeah. Left. Okay. In regard to advice, some staff conveyed they'd like to better understand how to communicate the long-term benefits of a healthy lifestyle in a more meaningful way. And in regard to connections, some staff noted that there's sometimes limited engagement with external services, and if there is, following up with those services can be challenging. So one facilitator took notes during the workshop using a software called Jamboard, and it looks like what you can see on the screen. It's essentially an online whiteboard of sticky notes, and this feature was quite effective in not only capturing what was being said for our records, but also provided an ongoing summary for all participants online and in the room. So after that, the facilitators proposed some evidence-based strategies. So these are some general strategies which have been implemented and evaluated previously in a variety of healthcare settings to initiate practice change. So these strategies were proposed to give staff an idea of what might be helpful for them or to assist them in having conversations, providing advice and connecting. As we know, these evidence-based strategies have the potential to be effective. So next was a group discussion about potential strategies. So drawing on what staff had said in the previous group discussion about aspects of support delivery they found challenging, we wanted to get an idea of what they might find helpful to address those challenges. Again, we used the Jamboards to make note of what kinds of strategies were being preferred or not preferred. So lots of thoughtful and interesting ideas were being put forward and discussed, which I'll note in just a moment. Staff then took a 15-minute break whilst the facilitators documented these strategies and put them into an online survey. So across both workshops, staff wanted training in having difficult conversations, a point of care prompt, and a guide for connecting people to behaviour change services, as well as a few other ideas. So an online survey was set up prior to the workshop, so all that needed to be done was input the strategies that staff had put forward. So after the facilitators documented those strategies, they were input into the online survey using RedCap software. So when staff came back from the break, they scanned a QR code with their phone, which took them to the survey, and they were instructed anonymously to rank 1 through 5 the strategies from most preferred to least preferred. So once all staff had completed their rankings, the facilitators exported the results and displayed them, as you can see. So the point of this activity was so that participants could see, as a group, how they ranked the strategies. So these are screenshots from those displayed in the workshops. So that's how it was communicated. Training, having difficult conversations was most preferred, and so on. So after the ranking activity, there was a group discussion about how some of those strategies could be implemented. And due to time constraints, we knew that we weren't going to be able to discuss how all 5 strategies could be implemented. So the ranking activity helped us prioritise the most preferred to be talked about first. Jamboards. So, for example, in relation to the training strategy, some thoughts were noted about when the training could occur and over what time period was feasible, and participants also noted that face-to-face training was preferable and delivered by someone with lived experience. So what are our learnings? So this was actually the first time the facilitators had conducted a workshop of this nature, so we weren't entirely sure whether we were going to get any meaningful outcomes, but we definitely did. And we also found that the software utilised was quite effective in consolidating and feeding back information. Also, we gained an understanding of some of the barriers that staff faced when delivering support, and that really helped contextualise those evidence-based strategies that had been previously used in research. So the strategies would be implemented as part of a pilot intervention. So the co-development workshops ensured that these strategies were more likely to be fit to practice, acceptable, feasible and appropriate for staff, as they were actually going to be the end users of those strategies. All right, thank you for listening. Sorry.